All right, I'm going to talk about the veins of the lower body and then the veins of the abdomen and how they all work together to bring deoxygenated blood and nutrients, all right, back from peripheral circulation. One thing you have to remember is when we compare the arteries on this side to the veins on this side, there are a lot more veins, right? The reason why is some of the veins are more superficial, others are deeper. Now, let's take a look very distally. What we notice is that you see one very long vein way up here and goes all the way to the inner thigh region. Number 70, this is called the great saphenous vein, right? It is very superficial and is very medial. The next very medial vein is this one over here, and is found lateral and very superficial, right? This vein right here is called the small saphenous vein. So the small saphenous vein is number 74. The great saphenous is number 70. All right, now the other veins that are a little bit deeper actually follows the arteries. So you see number 79. It comes all the way from the feet all the way downwards, upwards, right? This is your anterior tibial. All right, the anterior tibial then is going to drain, right? And you have number 78 also draining from it. This is a more posterior. This is the posterior tibial vein. The posterior tibial vein ascends up and receives the fibular vein, right? Fibular vein is number 76. As it moves up, right, both the anterior tibial, posterior tibial, fibular all drain and forms the femoral vein. Femoral vein goes all the way up. As it goes all the way up, it receives the great saphenous. In the process of receiving the great saphenous vein, it will then form and become the external iliac vein, right here. External iliac vein is number 67. As the external iliac vein comes up, it will receive the internal iliac vein, number 59. In the process of receiving the internal iliac, the combination of external and internal iliac forms a common iliac, number 58. The common iliac veins on each side fuses together to form the inferior vena cava. Now the inferior vena cava is pretty long. It runs the whole length of the abdomen. It's actually longer than the superior vena cava. The inferior vena cava moves upward and receives the renal veins, right? And we kind of mentioned it before, right? It moves all the way up, and in the process, you'll see two other veins that kind of ascend with their arteries. You will see the superior mesenteric vein, right here, slightly anterior, right? This is number 50, right? You will see the inferior mesenteric vein, number 52, running with the inferior mesenteric artery. So inferior mesenteric vein runs upwards. It receives the splenic vein coming from the spleen. They both fuse together, runs across the abdominal area, and then it receives the superior mesenteric vein. In the process, it will turn that into number 48. All right, this number 48 over here is the hepatic portal vein, and it enters the hepatic circulation.